My name is Byrd, and today I'll be doing my presentation of my dental internship. So, welcome to the office. I did my internship at Southern Family Dental Group. That's a general dentistry practice in Statesboro, Georgia. They're a personal family-oriented group. They accommodate for all ages, from younger children up to elder seniors. They do a lot of patients and their children, and also their parents as well. So there's 3 active practicing dentists in this dental office. The one that I did most of my shadowing with is Dr. Gerald Walton, DMD. There's also Dr. Colin Shrew, DDS, and Dr. Catherine Menser, also DMD. So the first thing I learned at this internship is that DMD and DDS is basically the same thing. The title just comes from, depending on which dental school you graduate from. DMD stands for Dentistry of Dental Medicine, and DDS stands for Doctor of Dental Science. So treatments and procedures. Most of the treatments that they offer at this practice is stuff like regular dental exams, hygienes and cleanings, teeth whitening. They also do veneers and Invisalign. And they also do more strenuous work like dental implants, dentures, and crowns. They do offer extractions and root canals, but if the extractions are a little more strenuous, they'll refer them to an oral surgeon. And root canals, they typically refer those to an endodontist, which is a specialist. And they also do gum disease treatments. So all this ties together to the fundamental basis of dentistry, which is the anatomy of the tooth. So what are the parts of the tooth? You have that outer layer, which is a hard tissue, and it's called the enamel. Under the enamel, you have the dentin layer, and it's a soft tissue that insulates the pulp. So what is the pulp? It's the blood vessels and the nerve system that goes inside the tooth and provides the tooth with everything it needs to be alive. So under the pulp chamber, where all the pulp is, you have the root canals, which is inside the roots. So the roots are the bottom part of the tooth below the gum line, and the crown of the tooth is the part above the gum line, and the neck is in the middle that joins the tooth. Now the interesting thing is that just like in your ankles or in your legs, there are ligaments that hold the tooth to the jawbone. And many times when patients come to the office with a toothache, they think it's deep decay, a cavity, or they think they've broken a tooth, which simply they just bent something really hard and it's bruised some of those ligaments. So we just tell them, we'll give them a little bit of pain medication and then tell them try not to eat on that tooth, on that side. So what's the enamel made out of? The enamel is 95% minerals like calcium and phosphorus, and they'll crystallize together to create that hard tissue. It's also 4% water and 1% proteins. Now the cool thing about teeth is that they're 99% inorganic material, versus your regular bones like your arms and legs are 70% inorganic materials. Now this is probably the trickiest part of dentistry, and I'm extremely proud that I've learned this, because every dentist and dental assistant said that they struggled with this in school, is the numbering of the teeth and then the faces. So you'll start with your maxillary, or your upper jaw on the right side, and go from 1 to 16. You'll drop down to your mandible or lower jawbone and go from 17 to 32. This includes your wisdom teeth, but not everybody has their wisdom teeth. Some do, some don't. So it's a lot easier to count starting with the middle teeth with 8 and 9 and 24 and 25, and then just count from the sides from there. So as far as the bite surfaces go, the inner surface of the tooth facing the tongue or the inside of the mouth is called the lingual, and the facial is the part of the tooth facing the outside. Now the premolars and molars, which are the back teeth, the bite surface is called the occlusal, and the bite surface of the canines and the 4 incisors, which are in the front of the mouth, is called the incisional. Now crowns. The crowns are by far the most frequent procedure that I observed at Southern Family Dental. And that's mostly because the office helped me out and they scheduled a lot more of the crowns for days that I was shadowing, because they do a lot more fillings than anything else, and fillings are very monotonous and there's not much to learn, relatively simple. So I thank them for spicing things up and letting me see different things. So what is a crown? It's a protective tooth-shaped cap that goes over the existing tooth that helps protect it. And when should you place a crown on the tooth? We should place a crown anytime that a tooth is fractured or cracked or has any type of trauma. Also, anytime that you extract a tooth, you may also be able to put a bridge crown. And as you can see in this bottom left picture, the extraction side, the 2 teeth on each side, have been prepped, and there will be a bridge placed with caps on both of those teeth. Also, anytime that a filling reaches about half the size of the tooth or greater than that, that's because a filling this size puts a lot of stress on the tooth, and it severely increases the risk of fracturing or splitting that tooth. Now, innovative technology in the dental field. Everyone loves the impressions that are required for crowns and how they make crowns. And this is infamous for gagging people and choking people, and everybody just loves it. It's a good time. Now they have technology that Southern Family Dental has just got in recent years, that now they can scan teeth instead of making impressions. So they'll use this scanner and a milling machine, and they'll also use a furnace. So now they still use some impressions with the impression material, but for the most part, they'll use this technology. So Cyrona is the name of the technology. Like I said, they have a scanner, and they'll use the wand on this scanner, and they will scan the teeth before and after prepping the tooth, and it's compatible with this milling machine. So the scanner will send the information to the milling machine to get the dimensions that's required for the crown. Now it has different burrs on it, just like the handpiece that the dentist will use, and it creates and cuts out the crown out of these blocks. Now it also makes the crowns 40% larger than is required for the patient's mouth. And that's because after it's made in the milling machine, the crown will be heated inside the furnace. And inside the furnace, it will actually shrink 40%. So to accommodate for that shrinkage, the milling machine makes it 40% larger. Now, 2 most common materials that they use in these mineral blocks is zirconium and EGSC. Now they use zirconium because that's the hardest material used in dentistry today. So they use it for the premolars and molars, since it takes all the abrasive power from the bite force. And EGSC is a little bit softer, but it's a little more attractive, as you can say, so they'll use that for the front teeth. Now the cool thing is, EGSC is actually purple, but once it's heated to the right temperature, roughly around 300 to 400 degrees Celsius, it'll actually come out to the natural tooth color. So some interesting things with this internship is the zirconium at 400 to 500 degrees Celsius. Even the dentists still like watching this happen, even though they've been using it for years. The zirconium, since it gets so hot, it'll actually glow, just like a glow stick or a flashlight. It gets extremely hot and it'll come out and it'll be bright just like this. So it's really cool to get to see them. I never get tired of going back to the lab and watching them come out of the furnace. Also, we have hypogonia. So hypogonia is actually a genetic disorder where the patient is missing 2 to 5 teeth. And this is a classic case where they mostly miss their front teeth. Now I put this on here because for genetics we were having to do presentations of a genetic disorder, and I thought about doing hypogonia but decided not to. So the day that I decided to change to something else, I go to my internship, and lo and behold, we find somebody that has hypogonia. And it's not very common, and I had never heard of this before I tried to look one up for the presentation. So I thought it was extremely cool to get to see something this uncommon, and I actually got to see it in person. Now also implants, this is kind of a joke in the office because that's one thing I haven't been able to observe are implants. And I'm extremely interested in them. I've done a little bit of research, done some papers on them. And the past 5 to 6 implants that they've done in the office, I've missed. I haven't been on the day that I've got to see them, and they keep joking and trying to schedule them for days that I'll be there, but I never did get to witness any. But actually this past Monday, I got to squeeze in an implant. I finally got to see my first implant from start to finish in the door. So it was great to be able to see, and it was very interesting to me. So in conclusion, this internship really helped me out making connections in the dental field. It strengthened my connection with my dentist, Dr. Jared Walden, but also the other dentists I've never met before. I've got to make connections with them. and also with the dental assistants. Also, it's increased my shadowing hours. To apply to dental school, there's a minimal requirement of hours you have to have. So this internship has surpassed the minimum number of hours, and now I'm getting closer to the 300 hours that they're really like for applicants to have. And also pre-dental school education. The things that I'm learning now in this internship are things that I would be learning in dental school. So anything that I learned prior to applying or getting in is just a step further than other people that are applying, and I may be able to breeze through it a little quicker and it'll be easier for me once I get in. And also experience. I really love to compare this internship to when I was volunteering as a dental assistant at a nonprofit organization called the Mercy Ministries Clinic. And I like to compare it to that because this is more cosmetics with crowns, veneers, fillings, less extravagant stuff. At the nonprofit organizations, we had things like extractions, like 8 to 10 extractions on one patient. We would open the gums, smooth the jawbone, and suture back up. So it was more oral surgery, more emergency treatments, versus this is more cosmetic. So because of this internship, I feel like I have a better grasp of the whole area of the dental field and every aspect of it. So I would like to thank Southern Family Dental for allowing me into their office and to be able to see how they perform all these procedures and treatments, and also East Georgia for encouraging me and allowing me to be able to do this internship as well.